Physiologic effects of obesity. As we all know, obesity can have a major impact in many processes in the body. So in this video, we're going to explain per system what exactly are the effects of obesity and how they can affect your health. This video series will be broken into different parts as it is long and extensive, and I'd like to be able to explain things clearly so that it's easier to understand. So in this part, we're going to discuss the cardiovascular changes that occur with obesity. First of all, let's start with the cardiovascular system. So one of the main or the first effects that obesity can have in the cardiovascular system would be high blood pressure. And now the reason why this happens is one mechanism is the increased production of a hormone that's called aldosterone. And aldosterone, when you have elevated amounts of this hormone in the body, can increase your blood pressure because it does make you retain fluid. One of the other effects in the cardiovascular system would be an enlarged heart. Reason being is because now you have more surface area that the body needs to supply blood to. Therefore, the heart has to pump harder, and because the heart is a muscle, the harder it pumps, the stronger the muscle will get. And stronger sounds like a great definition of the word, but what happens is the heart muscle just becomes thicker to be able to pump as hard as it needs to be able to provide blood to the needed body areas. This in turn can cause a significant effect later on in life, as it can induce a condition called cardiomyopathy. There are different types of cardiomyopathy, but basically what happens with the cardiomyopathy is that the heart is not then able to supply the blood needed to, whether it's because the heart muscle is so enlarged that it cannot take in the blood necessary to pump out to the rest of the body. It can only take a small amount of blood because the space that was once there available is now decreased because the heart muscle is thicker, as previously stated. Then over a long time, if this condition continues to occur, then that heart muscle then starts stretching, and then eventually you can have something called dilated cardiomyopathy, which basically means is that because that muscle stretched is now weakened, and so now it can take up all the blood needed to supply the rest of the body, but now it just can't pump as effectively. Another thing that can also occur is atrial fibrillation, and this is a common condition that is now present in the United States and even the world. But basically what happens with atrial fibrillation is that you have an inflammatory response created by obesity and the presence of increased fatty tissue. And so that induces this inflammatory response and cascade. And also obesity itself, you can have fatty tissue basically covering or surrounding the heart muscle. And this itself can induce atrial fibrillation or an electrical abnormality in the heart, only because, again, you have fatty tissue stuck to the heart muscle, and then also you have this inflammatory response that directly affects the heart, thereby causing an abnormal electrical response in the body, therefore atrial fibrillation or abnormal heart rate. And then the other thing that can also occur cardiovascularly would be neuropathy. Reason being is because you can either have plaques formation in the veins and the arteries, mainly so the veins, and so this affects the nerve endings and your extremities. Typically neuropathy happens in the lower extremities, and this is a cardiovascular issue because it first starts off in the cardiovascular system, so the venous system, in the arterial system. Blood is blocked from feeding some of the nerve endings, which then are affected and cause neuropathy or numbness and tingling in the lower extremities, or it can even happen in the hands as well. Stay tuned for part 2 of this video, as we are going to discuss the pulmonary changes that occur in obesity. If you like this video and you'd like to see more, don't forget to like and subscribe to our channel.